This is Dr. Roger Knapp, pediatrician. I'd like to talk about coughing. And boy, this is a broad subject and has a lot of different avenues to go down this road. The coughs frequently occur in kids and a lot of times not associated with fevers. If they have fever during the first 2 or 3 days of the beginning of a cough, it's most of the time going to be viral. And secondary infections like bronchitis, pneumonias, tend to be a week later. 7 to 10 days is pretty classic. So you can have your child checked out that first few days when they have fever, but it's more likely going to be viral, and we don't want to overdo antibiotics. So what you're looking for is fever the second week, and that's trouble. The cough can be clear, congested, mucousy sounding, or there's what's called croup, when they make a seal bark cough, and that's croup. There's medicine to help open up the airways. We usually give steroids. In short courses is safe, and so you give steroids to open up those airways. I can't remember the last child I had in the hospital with croup because we treat it with steroids and it opens up those airways. It's mainly right here, and what you'll have is a seal bark cough, hoarseness to the voice, but hardly ever gets into lower lung and pneumonias. Sometimes we see head and neck infections secondary, and it's typically a week later. But the croup is mostly right there. And it is slightly contagious. In fact, adults and older kids can get croup, but their larger windpipe, that swelling doesn't make that honk sound. So they'll have a kind of a nasty cough, and it burns right there when you cough, and hoarseness to the voice. It's actually croup. The cough medicines that we give, we try and help that out. Smaller kids, but especially below 2 to 4 years of range and younger, it's kind of hazardous, especially ones that have decongestants in it. Antihistamines are safe, but the decongestant that's in Sudafed, ephedrine, pseudoephedrine, those kind of preparations, that has some risk to young children. And the safest thing is to be safe and not risk secondary complications or even deaths from them. You can run the vaporizer, humidifier. Sometimes that moisture precipitates in the nose and makes it worse instead of better, so try it with and try it without. But that seal bark croup is really helped out by humidity. But the cough medicines, the younger kids, we just kind of bear with it. So when their child has croup, you can put them in the bathroom and steam it up like the London fog. And actually, if it's real cold outside, the coldness helps shrink back the edema, and the moisture, the moist night air, really can help that a bunch. There's many a kid who's had bad croup and breathing, and that's the sign that we want to see them right away. But they'll put the child in the car, go to the emergency room, and the child's breathing normal by the time they get to the emergency room. You've treated it. May as well go back home. Or if you want to continue to be seen and get some steroids, that would be fine too. The cough medicines as we get older is appropriate. And I like the ones that says cough and cold. You want a decongestant so you can breathe, and you want some cough medicine to slow down the coughing. It's not going to stop the cough, it'll just slow it down, and that's safe. Expectorants loosen the mucus. It's a chemical called guaifenesin. Tastes horrible. And if you have this much thicker mucus and you make it looser, you end up with that much mucus. We will get more mucus, and who wants that? So I don't really push those a lot. They showed in studies that a glass of water did just as good at loosening the mucus as those expectorants. So the old grandma advice of pushing a lot of fluids and giving Tylenol is probably pretty good advice. The cough medicines, as we get older, we can help that out, especially school age and teens and adults. I like Delsum in the morning, especially before school, because it doesn't make them drowsy. Whereas the other stronger cough medicines in the daytime kind of knock you out. At nighttime, you want a decongestant and a cough medicine. So preparations that says cough and cold. I think the strongest ones are NyQuil and Vicks Formative 44, but there's several others on the market. You want a congestion medicine because when you lie flat, that congestion is worse at night when you're trying to breathe. So cough and colds, medicines at night, and maybe Delsum in the morning before school. That's kind of a brief summary about coughs, and certainly if there's any questions, see your physician. Thank you. This is Dr. Roger Knapp.